Thanks a lot. Republicans begin work in the House to try to dismantle last year's health care reform law. The House voted to repeal the law. Unlikely it will pass, however, in the Democratic-controlled Senate. But the next step may be a measure-by-measure turnback. Congressman Spencer Bachus voted for that repeal this week. He joins us here in the studio this morning. Thanks for being with us today. A lot of things we can hit on. Let's talk for a moment about that health care reform plan. It includes things that are very popular measures like pre-existing conditions, increased coverage age for adult children living at home, age 26. Those are very popular. Under this repeal, those go away under this idea.
Well, yesterday we passed a resolution that we needed to pass those good things. But this bill is 2,400 complex pages of government interference between you and your doctor. It creates a tremendous bureaucracy in Washington. It's government command and control. It takes the individual out. I mean, you know, Rick, this country was founded, unlike European systems, where the people said, we're going to give the government so much control, but we're going to reserve that control, or we're going to give it to the states. And the federal government, this is a tremendous usurping of both state and individual rights.
And a statement that came out from the leadership yesterday, from the GOP leadership in the House, talking about rewriting this law on a case-by-case basis.
Yeah.
We've
always said, you know, that we support legislation that children up to 26 can stay on their parents' insurance policies, that those with pre-existing conditions ought to be allowed to have health insurance.
There's one proposal that was out there from Michigan's Fred Upton, a fellow Republican, who says you should be allowed to purchase insurance across state lines. That would go a long way. You agree with something like that?
Oh, absolutely. That would go a long way to increasing competition.
You have that statement that came out yesterday from the leadership basically said, you know, that ultimate goal, which I think everybody across party lines agrees on something like this, talks of lower health care premiums through increased competition. Now, the White House and Health Secretary Kathleen Sebelius pointed out in the last couple of days in talking about this, saying, look, we have these insurance exchanges that kick in 2014, that state by state allowing for small businesses and individuals to pool their resources, to give them bigger buying power in the market that allows for more competition. You think that's a bad idea?
Well, why wait to 2014? You know, the only thing they're doing now is collecting the premiums. The long-term health entitlement doesn't even start for 10 years. So we're talking about legislation where the benefits start in either 3 years with the health insurance or with the long-term care 10 years. But the taxes, $770 billion, start now. Let me say, the fact that we had an election, the American people said, look, start over. They don't like this. We don't like this. Abortion is mandated in this bill, abortion coverage. This bill has got so many snakes in it. It has so many problems. It has so much government command and control. Wipe it out and start over with those things that you and I and most Americans agree on.
Let's talk a little bit about, let's shift gears and talk about another area. You're chairman of House Financial Services. You make the argument that the criticisms about the health care plan, same criticisms when it comes to financial regulation of the country. Does that mean you try to roll this back?
Well, we have acted on consumer protection. I supported a lot of the credit card changes. I've supported a lot of the consumer protection. I don't support too big to fail. We've gone from the largest 7 banks in the country controlling about 25% of the assets to 70% of the assets in 10 years. Fannie and Freddie giving loans to people with no down payment and poor credit, taxpayer picking it up. We've got to quit government subsidized mortgages and government guaranteed mortgages. You know, the taxpayers do not need to insure the failure of others. We've got, it's a 2,400 page bill, which bankers are already telling me that examiners, even before this bill, were in their bank saying, you can't loan to this person, you can't charge this interest rate, micromanaging loans. I don't want a consumer protection agency that can come in a bank and tell a bank that they have to call this loan, that they have to make this loan, that they shouldn't have made this loan. That, we've never yielded that power to the federal government.
The President's State of the Union is next Tuesday. We will be covering that. This is kind of a preview of what's out there between the two parties as we go into it. Quickly, just one word, a couple of words answered if you can. How do you grade the President at his midway point?
The President of the United States?
Yes. What would you grade him?
I think his speech has improved in the last 2 or 3 weeks. He's hired some new people. The policies have changed. He can change faces. But I want to say this about yesterday and the day before. We kept our promise to the American people. We proposed $2 trillion worth of spending cuts, and we delivered our promise we made in November.
That'll be the last word today. Congressman Bachus, thank you very much for being with us today.